We can't choose when we get sick. Diseases don't respect office hours. So now the government wants to make it easier for people to fit a visit to their GP into their work and family commitments.
We'll see if it is possible to have a service where people can email their GP from work, whether they can go and see their GP after they've finished work, whether they can go in at the weekends. And of course it could make a real difference in A&E departments as well.
Earlier, the Health Secretary and the Prime Minister visited a GP surgery in Manchester, which does open 7 days a week.
What sort of person might you get coming in?
The pilot scheme announced today encourages other practices to bid for a share of £50 million so they can set up schemes that make doctors more accessible. As well as giving patients access to GPs 8 a.m. to 8 p.m. every day of the week, the government also wants doctors to use Skype, phone and email for consultations, plus provide online booking for appointments and electronic prescriptions. The vast majority of GPs do offer early morning and evening appointments. So you start at 7:15?
7:15 in the morning.
They fear trying to cover 7 days will mean patients who really should see the same doctor each time will lose out.
That's going to take it away from mothers of small children and the chronic sick, typically the elderly. Now, these are the people who need continuity of care if they can possibly get it. They're not going to get that if doctors just work a shift system in order to provide extended cover for some people who might want to benefit from a 8 p.m. on a Saturday night routine surgery.
The Royal College of GPs says surgeries are already too stretched. Extending hours could actually make things worse.
If we do spread ourselves over 7 days, you will find practices having to shut. You will find unsafe working patterns, so doctors having to see more and more patients in quicker and quicker times. That is not safe for patients.
The government hopes extending GP hours will take the pressure off hospital A&E units. But doctors say the patients who are the greatest burden on hospitals will be best helped not by getting a weekend appointment, but by getting continuity of care from the same doctor. Catherine Jones, 5 News.